Well, let's jump into reversal. Somebody's developing these pimples, either small, large. At that point, what's the best they can do to reverse that?
In my patients, in general terms, Jesse, I look at four things. I look at the diet. So we get them on a diet that's anti-inflammatory, low carb. Because part of the puzzle of heart disease is chronic inflammatory. And looking at the best data we have, I know nutrition science isn't great, but the best available evidence, and that's what I wrote about in my book, it comes from some benefits clearly from the traditional Mediterranean diet. So it's extra virgin olive oil, it's oily fish and the omega-3s from that. It's, polyphenols from non-starchy vegetables. It's nuts and seeds, and it's minimizing the starch and the sugar. So I call it a low-carb Mediterranean diet. That's my first-line approach from a diet perspective. It's not being sedentary. I think we've overdone the exercise story. I think a lot of that's come from the food industry as well, from McDonald's and Coca-Cola, the biggest promoters of exercise, so they can deflect from their bad diet that they're promoting. If you look at these communities with high longevity, these people weren't pounding it in the gym. They were just outside. Essentially, they were walking. I think walking is underrated massively. I think walking is a phenomenal way of keeping the circulation going without overstraining your body. Because on exercise, by the way, let me just briefly talk about this. This gets a lot of eyebrows raised, and a lot of people ideologically don't want to accept it. And these are especially the people that who are OCD about exercise. And you're talking to a guy that is guilty of this myself, right? I've overtrained, I've caused injuries because I have been, my day is not complete unless I've worked out. Okay. I'm that kind of guy. My ex-wife used to complain that we were on vacation. I was getting out of bed early to go to the gym. I'm that guy. So I get it, right? It's like a drug. Okay. Working out in many ways. In fact, that's one of the reasons I do it. I think it's great for mental health, but you can overdo it. And actually, one bit of information came to me from one of the top sports science cardiologists in the country, and letter once, and I was like, oh, this is so interesting. I haven't been able to look at that specific data. I'm sure it's there, but in essence, he said something along the lines of the 11% of elite athletes, by the time they hit 50, will have calcium scores over 1,000, Jesse. Okay, their event rates may be lower, but they've developed coronary artery disease. And it makes sense to me that if you are training really hard, especially with under recovery and high stress, it's probably a very, very bad for your heart. So I just say keep the exercise simple, keep it moderate. If you can do two 30-minute brisk walks a day, amazing. Even one 30-minute brisk walk a day is really good. Walking the dog, for example, great. Okay, yeah, add in a bit of resistance training as well, good for your joints as you get older, etc. From a heart disease point of view, I don't think there's any clear data that is dose dependent once you hit moderate exercise. Definitely better than being sedentary. But once you hit moderate regular exercise, I don't think there's any strong data that, and we know that from Olympic athletes, elite athletes from ex-Olympians, elite athletes don't live any longer than people who play golf, for example, or cricket. Okay, so just giving some perspective there. The third component, well, of course, the fourth. It's still important to mention is smoking. I used to mention, on the ward rounds to patients, this is true. Stopping smoking after a heart attack has much greater impact in preventing a further heart attack than all the medications we give people, including aspirin, etc. So if you're a smoker, and within 5 years of stopping smoking, if you're middle-aged, your risk of a heart attack becomes the same as someone that's never smoked in their entire life. So that's a very powerful intervention for smokers. And then I think the one that is maybe one of the most important that is missed is stress. Chronic stress, to a reasonable level, and I know it's subjective, is the equivalent of smoking 20 cigarettes a day when it comes to heart disease. And most people are not dealing with it. I know this all the time because invariably every patient I see that comes to me with a diagnosis of raised calcium score or heart disease or had a heart attack, all of them in the preceding 5 years have had stress levels that have been at least a 6 or 7 out of 10. And what's the mechanism though, right? This wasn't very well understood. We kind of knew stress wasn't good, but it wasn't very well explained. And the mechanism is likely chronic inflammation and can even be explained from an evolutionary perspective. So, tens of thousands of years ago, we're in the jungle. Where stress is acute stress is life-saving when we're escaping from a saber-toothed tiger, right? Because we need to get the hell out of there. And acute stress, in that sense, what we know physiologically, what happens is it increases clotting factors and inflammatory factors in the blood, so that if we're attacked, the risk of us bleeding to death becomes reduced. Now imagine that chronically turned on at a low grade. And that's probably the mechanism of how it contributes to heart disease. But this is where the reversal comes in, if you're happy for me to mention it now, Jesse.
Please.
Is the best available evidence of reversal, which I write about in my book, A Statin-Free Life, comes from India. And this was called the Mount Abu Healthy Heart study, something along those lines. It's a long name for the title of the paper. I actually met the cardiologist that did this study. And he started it in the early 2000s. There were no statins involved. And these were patients that came to him who had moderate to significant heart disease diagnosed from the gold standard test, which is a coronary angiogram, an invasive coronary angiogram. And they had at least a 50 to 70% blockage in multiple areas of the heart. And they were, they didn't want to have a coronary artery bypass operation. They didn't want to have stents, either from a preference point of view, an ideological, we want to avoid medical intervention, or because they couldn't afford it. So he put them on this lifestyle plan. There was hundreds of patients in middle age, and they were devout Hindus. And so their diet plan was actually a high fiber, more than 50 grams a day of fiber, high fiber vegetarian diet, not vegan, but vegetarian. It was 2 30-minute brisk walks a day and something called Raj Yoga meditation for 40 minutes. 2 years later, he repeats the angiograms. Extraordinary findings. Literally at the time, unbelievable. And if you tell this to most cardiologists, they would say it's not possible. They've never seen anything like this. I actually had to go to India to see for myself these angiograms and meet the guy, and it was real. These are genuine. On average, of the people that had adhered to the lifestyle plan, there was about a 20% reduction, Jesse, in the blockages, which is unreal. 70% became 50, 50 became 30. There was also lower event rates as well, which obviously is important. So less hospitalizations with angina, heart attacks, etc. And then when he did a multivariate analysis, so trying to dig out was there any independent factor of the lifestyle intervention that reversed heart disease? And the only independent factor significantly that was associated with reversing the blockages was 40 minutes of Raj Yoga meditation a day. Now, that isn't just meditation. What he did in this ashram, essentially, this place in India, Mount Abu, which, by the way, if anybody wants to go and visit this place, it's extraordinary. It's actually free. It's paid for by charity. So people basically go there and they live in this ashram for 7 days. They take family members with them. And it's essentially these lectures to explain this Raj Yoga meditation, but it's a way of thinking. It's almost like a spiritual awakening to reduce anger. What's driving your anger? Family members involved to support you. Why? Because it's a mindset, as well as the breathing techniques that are adopted. And that's what he did. And it has plausible biological mechanism.
Okay, so 40 minutes a day. Do you know specifically what that period of time looked like?
I think it was a mixture. It could be 20-20 or 40 minutes in one go.
But what kind of meditation? Do you know what they were doing?
Yeah, well, it was a meditation of essentially a meditation where you sit and you think and you're with your thoughts and you are trying to reduce anger and anxiety. There is a breathwork technique as well, which I incorporate, which is part of the Raj Yoga. But it's a form of diaphragmatic breathing. And I work with a cardiac specialist nurse that teaches patients how to do that. But essentially, and I do it every morning for 20 minutes. And it's been shown and proven, it's the best evidence-based breathing technique for improving cardiovascular parameters like blood pressure, heart rate. And I think that's essentially the best people can do. I myself, Jesse, still haven't gone. I need to do the course because these, by the way, you might have it in the States. People can look it up. They're all over America. You need to look for these Raj Yoga meditation centers and basically go there, and essentially it's just a week. You get trained up in a week. I haven't had time to do it yet, but I will at some point.
Okay, so far in the research then, for reversal of plaque, this is the only way we've seen it done?
Yeah, as far as we know, I mean, there is the Dean Ornish study on the vegan diet. But the only thing with that is there's a big margin of error when you're interpreting angiograms, looking at plaque regression. And if I remember correctly, and I think Dean's done a lot of amazing work, with their multiple lifestyle. And I don't think they differentiated all the different components in terms of what was driving it, but it was about 1.3% or something. Now, what's interesting is the cholesterol, LDL again, in the Mount Abu Heart study did not show any independent association with lowering that with reversal. So again, it's more evidence that it's not the LDL cholesterol. And it almost certainly isn't the vegetarian or vegan diet per se. Maybe the fact that, it's a otherwise healthier diet because you're not eating lots of ultra-processed food and sugar. Although there was a reasonable amount of starch in there, albeit very high fiber. It was quite clear from his own analysis in that paper that it wasn't the vegan diet, the vegetarian diet, basically, from not Dean Ornish's study, but the other one. And even Dean Ornish's study didn't show, as far as I remember, and Dean, forgive me if I'm wrong here, but it's been a while since I looked at that paper, but I remember there wasn't a clear independent association with lowering LDL from that diet plan and the improvements.
Okay, so when it comes to the meditation, they were able to show a reversal. How quickly did that happen?
Oh, well, they repeated the angiograms in 2 years, and then they did it again at 5 years, and it was sustained.
Okay, I mean, they've never been able to continue long-term to see if they would completely reverse?
I don't think they did any more angiograms after that, Jesse.
Okay, somebody wanting to be really practical with what we talked about here, the stress reduction piece, the potential there for reversal. What's the easiest way for them to jump into this at home?
Probably go on YouTube, first of all, and look up Raj Yoga meditation and look up diaphragmatic breathing. I mean, that would be a free way, an easy way. I always think it's better to see a practitioner, but if you can learn it from YouTube and follow it, then great. I think at home, you basically have to just eliminate all ultra-processed foods, which is anything packaged that has 5 or more ingredients, usually with additives or preservatives, and sugar, free sugar. So no juice, no candy, no potato chips. I mean, the way to do this, if you're going, it depends where you're starting from, but I would say you do this for 6 weeks cold turkey to break the addiction to starch and sugar. And then you can maybe modify things. But it also depends where you're starting from, Jesse, as well, right? If you're just got one metabolic health marker and you're otherwise slim and you're moderately active, you may not need to go that extreme. So it depends where you're starting from. But just eating a healthier diet already is going to make a big difference.
Since you made it to the end of this clip, I know you're going to love the full episode. Click here to watch. I'll see you over there.
I trained as an interventional cardiologist. I love solving puzzles. When you've eliminated the impossible, whatever remains, however improbable, must be the truth. Guideline bodies still say that LDL cholesterol is the primary causative risk factor for heart disease.